Hi, everyone. I'm just going to let people trickle in before I get started. Hi, we'll get started in just a minute or two. We'll get started in about one more minute. Okay. Hi, everyone. Thank you for joining me today. My name is Dr. Brittany Merrill, and I work at the Center for Children and Families of Western New York. We're going to talk today about children with ADHD and what parents can do to help their children succeed in school. So first, a little background. We are at the Center for Children and Families in Western New York. We're affiliated with Florida International University, which is one of the largest Florida state campuses and is really involved in many national and international communities. And our satellite office, the CCF of Western New York, is located in Buffalo, New York. Dr. Fabiano, pictured there, has worked in Western New York and with children with ADHD for over 20 years. And our team here studies effective approaches to help individuals with ADHD across the lifespan. You can see I put some contact information there, including our socials, and the last slide also has the same information. So I'll leave that up as we leave time for questions. Also, if you have any questions throughout, we'll be monitoring the chat and the Q&A, and you can also raise your hand as well, and I'll try to call on people as I go through. Okay, so the agenda for this evening is going to be to talk a bit about childhood ADHD in the context of COVID-19. You came to the earlier presentation that was more related to teachers. There might be some repetition there, but I promise the rest of the talk is not going to be as repetitive with that. So stick with us, and it'll give some context to everyone who has not attended another one of these talks. And then also after that, we'll talk a lot about behavioral treatment and then get into some really actionable tips for managing homework and home learning for children with ADHD. So children with ADHD might struggle a lot with the return to school and also might be at kind of more risk for struggling throughout the home learning and remote schooling that we've all kind of been experiencing on and off. So for background, childhood ADHD is associated with symptoms of inattention and hyperactivity and impulsivity. And these difficulties occur across settings for these students and children. So most often they're having difficulty at home and at school. And a key part of ADHD is that these symptoms are causing impairments or difficulty, like I said, in these children's everyday life across different domains of functioning. For example, they might have a hard time with peers in making or maintaining friendships. Most children with ADHD have some difficulty in the school setting, such as showing some disruptive behavior in the classrooms, having a hard time staying on task or completing their work, or kind of making careless mistakes so that their performing or their grades are a little bit lower than what you would expect based on their academic ability and how well they understand the concepts. And then in addition, there tends to be problems at home as well, where these behaviors and these symptoms are causing stress at home and stress for the parent and also kind of among the family. So having to repeat directions all the time and worrying about kind of your child following through with things or even being safe if they're pretty hyperactive can just cause a lot of stress at home. And then in addition to that, we've done remote schooling, and some children with ADHD have done a little bit better with remote schooling because the academic demands have been reduced in the last year, which makes perfect sense and is a very reasonable reaction to such a stressful time, right? We kind of need to prioritize the whole child at this time, but those reduced demands might make the return to school just a little bit difficult. So it's something we'll talk about, how to kind of get kids back on the track and the routines with school. Because at home, they had a less consistent routine and schedule than school, right? Schools are just more structured places than home. One thing that is also a concern for children who have been doing remote schooling is that teachers are particularly well prepared to kind of identify when students or children's behavior is outside of the norm. And that's just because teachers see a lot more students or see a lot more kids who are the same age than a parent does. And so we might be kind of missing some of the students who do have difficulties with attention because their parents just don't have as many things to compare it to. I know I've had many patients, families that begin to recognize that their child has problems when difficulties with attention, when the younger sibling is having an easier time with things than the older sibling. And that's when they realize maybe there's something more going on. Maybe it's time to find some treatment. And also, it's been a stressful year for everyone. And in the context of remote schooling, there is additional stress on parents. So it's important to kind of accept that and move forward and try to make the best of the return to school and of the following year as well, and really set kids up for success. So there are a couple of different treatments that are evidence-based for childhood ADHD. And they are essentially medicine, medication, and behavioral treatments. Those are the two kind of main categories of treatments that work for ADHD. And we're going to talk about behavioral supports today. And so behavioral treatment is based on theories of behavior change, essentially that children learn through observing. They learn through modeling, which means they see how parents and older siblings and other adults react in situations. And then they kind of try that out for themselves and see how it works. And that's the imitation piece, right? That's how we learn to speak. And that's also how children learn to behave. They just try things out that they've seen before. And then they do more of the behaviors that work for them, right? So if they try out a behavior of kind of following through when they're asked to do something and they get some positive reinforcement for that, they get some praise from their parent, that's really powerful. And so they're more likely to do that again. And this is how we modify behavior. And I didn't include it in this presentation, but I do want to say, so we work within behavioral theories to change behavior among children with ADHD and a lot of difficulties, different difficulties. That does not mean that parenting causes ADHD, because parenting does not cause ADHD. ADHD is highly genetic. However, changing these things in the environment, including how parents interact with their kids, helps lead to more positive interactions and then more positive outcomes for these children. So I just wanted to make sure I clarified that. So a really straightforward way to think about behavioral treatments is this ABC model, which we will continue to talk about throughout today. And this is the antecedent, behavior, and consequence model. So what we want to change is child behavior, but you can't just directly change child behavior. You can't just wish it to change and then it changes. What you do have control over are the antecedents, what happens before the behavior, and the consequences, what happens after. And the antecedents include time of day, the setting, the way that you request a behavior from your child, and how they're feeling that day, right? Those are all setting events. Those are all things that are happening before a behavior that we might want to change. And consequences doesn't mean something bad or a punishment. It's just whatever happens after the behavior. And this can be positive or negative. And we'll definitely talk more about that. So let's focus in on the B in the ABC model. You can't change what you can't see or measure. It's really hard to evaluate change if you don't know what change you're looking for more specifically. And so we want to make sure when we're thinking about child behavior, what is the behavior that we want to see? We need to think about this in a concrete way and in a way that's observable. So for example, if you tried to figure out the antecedents and consequences, the reasons behind why your child is being lazy, for example, it's going to be really hard. Because what does lazy mean? And why is it kind of important to figure that out? Instead, you might focus on completing chores. So it's not that your child's lazy, it's that they didn't do a thing that you expected them to do and needed them to do. And so if you think about completing chores, that's going to be a lot easier to figure out what the setting events are, the antecedents, and what the consequences are, the things that happen after the behavior. And so for chores, maybe you figure out that when you ask your child to take the trash out first thing in the morning, they don't do it. But if you ask after they've been awake a while and they've eaten breakfast and they're about to leave, they're much more likely to do it. So because you have a behavior that you've really identified, like what is the behavior that we want to change, it becomes a lot easier to figure out how the environment might be affecting it. Behaviors related to school or academic work at home are things like sitting down to start homework. So not something really broad, like they're just not doing their homework. It's really hard to figure out how to affect that. What's the real problem? They're not getting started. They're not sitting down. They didn't complete all of the questions, or maybe they're complaining, right? So those are the really concrete behaviors that we want to talk about. And after you identify behaviors, then you figure out what the antecedents or consequences are and attempt to change them to see if that improves the behavior. So here's an example of Susie, who's 7 years old, and she has ADHD. And she's typically not disruptive at school and gets most of her work done with some redirection. You know, the teachers noted that she needs more redirection than other kids, but she does get it done. But at home, she tends to like talk back and argue whenever mom tells her to turn off the TV and start homework. So the behavior here is that non-compliance, arguing and talking back, right? That's the real problem. And probably also not sitting down to start, but we'll start at kind of the first behavior. And what happened before the behavior? The antecedent was a parent request to do academic work, which, you know, I'm sure Susie probably doesn't love and isn't excited about. And also, she's watching TV. So there's a big difference there between what she wants to be doing and what she's being asked to do. And the consequence of her being non-compliant or talking back is that she's got to avoid homework for just like a few more minutes. This might not seem like much to an adult, but to a kid, those few more minutes can be really reinforcing and make it common for them to keep kind of arguing or being non-compliant in the beginning. And so what we'd want to do is change the antecedent and the consequence, which is what we're going to talk about today. This is another example that we'll work through quickly. So Jacob is 9 years old and he's spending just so much time on homework, hours, which can be very frustrating for families. And he starts with math homework most nights and gets it done quickly and accurately. He likes math, he's good at it. But when it's time to start reading, he complains that it takes too long and he's whining and avoiding. And then his parents try to reason with him, which happens, that it's really important to do well in reading so he can get good grades so he can go to college. And Jacob is 9. So that might not feel like a very important consequence to him in that moment, right? It's really far away. And it's hard for kids with ADHD to think about something that's that far away. So let's figure out what the antecedents and consequences are. Behavior is definitely the whining and complaining. And the antecedent is that he's doing homework and it's specifically during reading that we're having problems. So why is it harder during reading? That might be something to think about. And then he also, again, gets to avoid homework for a few minutes. Critically, in this example, the reasoning and trying to talk about all of the really important reasons why you should do your homework get him a lot of parent attention and that back and forth. And even though it's kind of an argument or a convincing situation that might not be very rewarding for you as parents, that's still parent attention. And that is your most powerful tool as a parent, is your own attention. And whether it's positive or negative, it tends to make whatever happened before more likely. So whatever you give attention to, even if it's yelling, that behavior can increase, especially among kids with ADHD, because they're hearing a lot more yelling than other kids. So we might, for this example, you might try doing reading first and see if that works. Maybe when he has a little bit more energy, we can do reading first, and we know he can get the math done quickly, so it's not as much of a concern. And then for the consequence, you would want to not engage in that back and forth, right? Because that just gives him that attention, and it's just not that helpful. Let's talk about specific strategies for homework. In this ABC model, we have antecedent strategies and consequence strategies. So strategies related to how to be prepared, how to set up the situation for the best outcome, and then strategies related to how to reward behavior or what to do if it's not getting done. And so some antecedent strategies are going to be to have a really consistent routine. So routines and schedules are incredibly helpful for children with ADHD. They have a hard time with time management and with kind of knowing how long things take and knowing what to do next and how to organize steps of different routines and processes. So having that routine, even if it's a visual routine, that can be really helpful for them to help kind of accommodate the difficulties that they might have. The consequence strategies, I'll go into a bit more detail, are, for example, when-then statements. So when-then statements are a way to let the child know that when they complete math, then they can have a 5-minute break. And it helps avoid some of these back and forth arguments, right? So instead of engaging with, I think I named him Jacob in the last slide, instead of engaging with him about that, you might say, when you get your reading done, then we can go outside and play catch for 10 minutes. And then that kind of ends the conversation. Like, we're not gonna go do that until you go finish your reading. And as soon as it's done, we'll be able to go do the fun thing. So you just let me know when it's done, right? And that helps reduce that family stress too. Because I know it's hard for parents of children with ADHD to be managing academics. It was difficult enough when it was homework. And then with home learning last year, I think it only increased stress. And then we'll talk about breaks. And we already talked a lot about parent attention. I think one thing to note on this at this point is, again, that praise is your most powerful tool that you can use. So parent attention is incredibly powerful, but specifically figuring out what it is that you want to see and then telling your child that they did a great job anytime they do that. So thank you so much for sitting down to start homework. I love the way that you have your pencil ready to go. Right? It can be simple as that. We want to give lots of praise. Okay, some more information about antecedents. So we want to be prepared. We want the location for homework or for home learning to be free from distraction and consistent. It's really important that it's consistent. And we want it to be accessible to you as parents to be able to monitor and check in. So typically not upstairs, kind of in a bedroom. Since it's after school, parents are typically in the kind of living room or kitchen. So somewhere around there is helpful as long as the TV isn't on, because that can be a big distraction. And then you want to be prepared with materials. So one cool thing you could do is make a homework kit with your child and kind of work together on that to get the materials all together. And so it's just in the homework spot, or it's something that can be moved around easily to the homework spot in case it's on like the dining room table. And it might be helpful to kind of have a timer. Logins for online learning is something that we've added recently. And then anything else they need, books, agenda. And the timing of homework is probably the most important thing. So as I said, children with ADHD need structure and routines to help them succeed. So you want to start homework around the same time each day, and you can take some time to think about when your child is best able to pay attention. So for instance, maybe your child needs, 20 minutes after school to decompress without any screens or anything, but just some time before getting right back to schoolwork. And that's totally fine. And you want to make sure that meals can occur around homework time as well, and that there's time built in for breaks. And then it can be really helpful to have time limits. This is a little bit more difficult of a strategy, but essentially children with ADHD can end up spending hours on homework, which is not what anyone wants or needs, right? So the child doesn't really benefit from that. Parents, that's incredibly stressful, right? That's not what you would prefer. And also teachers do not set up homework to take that long, right? So that's something that you would communicate with the teacher about and try to figure out what's going on there. And then you could consider setting a time limit of, for example, about an hour and a half or 2 hours, depending on how old your child is and how long the teacher says homework should take. And then you want to think about breaks ahead of time. The simplest thing is to have breaks after each subject area, right? And you want them to, again, not involve any screen time. I know you all know this as parents, but once you get a screen involved, then you have the difficulty of the transition away from the screen, which can be difficult. So you can get creative, dance with your child in the breaks, get some snacks, stretch, chat with an adult, choose which reward you want after homework is done. That can be really engaging so that you're all ready to go as soon as homework is finished. And then in addition to having a consistent routine, one thing to really think about that can be helpful is your role during homework time. So there's a lot of stress around homework, and this can often relate to the role that parents are taking during homework time, specifically that they're really being the homework tutor on the left here the entire time, right? So kind of with your child the whole time, working through the problems with them and being really involved. And typically teachers give homework with the goal of practicing a skill that they've already learned in class. So we really want to have two different and really clearly distinct roles during homework time. One is the homework tutor. So getting your child started, making sure they understand the instructions for that subject. And then after they finish that subject, checking in and making sure that it's done right and working through any difficulties they had, and then getting them prepped for the next subject. And then when they're actually working, you want to transition really clearly to being more of a homework supervisor or monitor. And that's where you want to be available or close enough to monitor, but not really available for questions or anything. That'll wait until they're done. And then you can also really, really importantly, provide a lot of praise. So you're monitoring, you're nearby, maybe you're kind of cooking or spending time with your other child or something like that. And then you notice that they're on task and you just real quick walk over and say, thank you so much for being on task. I love when you're focused on your work. And then just keep going with what you were doing until they're ready for you to kind of step in as the tutor again and make sure that it's looking good. So right here, I kind of summarized these things in a table that can be really helpful. And I'll also put a link in the notes for our kind of quick, brief overview of supporting children with ADHD during homework time. So the homework routine that we've just talked about is really the where, the when, and the what of homework, right? And you want to set up a system for this so that you have a consistent location, consistent time with some breaks, and everyone knows what they're supposed to be doing. And please let me know if you have any questions throughout in the next few minutes. So working with schools. I already talked a little bit about what if my child is kind of spending far too much time on homework. So one thing is perhaps setting a time limit. And a really important thing here is to reach out to the school or to the teacher more specifically to figure out what the purpose of the homework is. So if the purpose really is to practice things that your child should already understand and know how to do, then an accommodation for children with ADHD can be that they don't have to do quite as many of those practice items. So maybe most kids in the class have to do 10 of these word problems, for example, and a child with ADHD maybe only has to do 7 or 8. Because it really is just practicing, and the amount of stress and difficulty that it might be causing at home isn't helpful for anyone and isn't helping the child learn. So that can be an accommodation. And speaking of accommodations, that can be part of a 504 plan. 504 plans are available in schools for children with ADHD, so that's something you can pursue, and feel free to reach out to me with any questions about that. And this is a way of just really documenting what the accommodations are for the student. More often than not, teachers are providing a lot of these accommodations without a 504 plan. So things like preferential seating, for example, can go in a 504 plan, but teachers can also just do that because they notice that a certain student does better when they're closer to the teacher. And teachers in general can be great resources. So I would recommend if you're really struggling with homework or home learning to try to problem solve with them. And just to summarize here, we want to keep this ABC model in mind and to problem solve with that. And then we also want to reward good behavior. So catch your child being good during homework time by praising him or her for sitting at the table to start, as I gave an example before. And also use your attention wisely. So if your child whines a little bit when you tell them it's time to start homework, but they do go sit down, I would recommend just kind of ignoring the whining for now because they're doing what you asked. So that's pretty good. And at the end of homework time, try to check in, see how they did. And again, give them a lot of praise. They got it all done. That's awesome. And if you're going to provide some correction and some feedback, make sure you identify something good that they did before you go in and start providing corrections or feedback. And then you can give rewards, and you can really simply just use when then. When you finish your homework, then you can have tablet time or screen time. And then again, just work with the teachers and school staff for these types of things as well. Try these out at home. The routine and the consistency can be incredibly helpful. But if it's not sufficient, make sure you kind of work with the teacher. And that's all I have. Again, we're the Center for Children and Families of Western New York. I really appreciate your attention. And we are currently recruiting families of children with ADHD or difficulties with attention and behavior. So please feel free to contact us. And we have our social media and everything on there as well. Thank you. And please feel free to raise your hand. I've been keeping an eye on that, or go ahead and put a question in the chat or the Q&A. Yeah, Virginia, I can, if you want to go ahead and put your question in the chat. And I'm glad you found it helpful. And also, if you prefer not to, you can just contact me. I'll give it another minute and hopefully be able to respond. Okay, well, thank you all for your time and your attention. Please feel free to contact me. My email is there, or our center. And then also we're recruiting families both in Western New York and Miami, families of students in elementary school who are struggling with attention or behavior. So if you live in either one of those general areas, feel free to give us a call. Thank you.